There have been various incursions to Medicare in Canada with private health clinics appearing. What are your polls telling you about those Canadians' attitudes towards that?
Well, that attitude actually is largely driven by the perception of long wait lines and the belief among some Canadians that for-profit healthcare is the solution to shortening waiting lines. So that's really what the focus is. And you know, when Canadians cite what they like about universal healthcare, it usually has to do with accessibility and the fact that it's free and affordable. And you know, when they talk about potential weaknesses of the public healthcare system, usually wait lines is the #1 concern that they have in regards to public healthcare. So it's not surprising that, you know, for those that would like to see more profit in the healthcare system, their focus or wedge communication relates to wait lines and their assertion that they can be shorter in what I'll say a mixed system.
Does your polling work and your understanding of polling that's been done tell you what kind of arguments will work best in the struggle that the people in this room are waging to save Medicare?
Yeah, I think basically stick to the basics in regards to ensuring that there's health care that's accessible to all, ensuring that Canadians have access to services, that quality is strong, that health care is funded so that we have the necessary doctors and nurses in order to ensure that we have strong health care outcomes. I think the challenge is that making it relevant. You know, it's kind of like a battle from the past, and creating a sense of urgency is difficult. And I think that's the real challenge right now, to create a sense of urgency to keep fighting for public health care.
You've said that Canadians identify with Medicare. They find it a big part of their identification, their identity as Canadians. They identify with it strongly. But is that an old battle, or is that something that we need? I'm not quite sure how to put it, but I have the sense that in the battle over private health clinics, that there are arguments being made that well, Medicare was good, but now we have to move on. Is there a way to get back to that sense of identity and make it work for advocates of Medicare in the debate?
I think the #1 challenge is complacency, and that people take universal health care for granted. I think that's the #1 challenge for those people that want to fight for public health care. And, you know, it's a compelling argument on the other side, too, to say, you know, who's to tell someone else that they shouldn't have faster access to a medicine or to a medical procedure when they have a loved one that's ill? So, you know, there are compelling arguments on both sides. But, you know, I think for those that want to fight for public health care, their key priority should be kind of what I'll say the basics in regards to the economics of public health care and its ability to deliver universal access and health services to Canadians across the country.
Thanks very much, Nik Nanos.
My pleasure. Good, guys. That was